I'm Guedy Arniella, a clinical social worker at the Institute of Family Health. It's a federally qualified health center network, and I've been a co-PI on several CDC and NIH grants. For the past 20 years, my department has worked toward addressing health disparities, and specifically, we've developed expertise in working with East Harlem older adults and inviting them to participate in community-engaged research. Black and brown communities are hesitant to engage in research for obvious reasons. They don't trust the medical profession, and I would say there isn't a lot of information to help them understand what research is all about. The best approach for engagement in clinical trials with older adults is to establish a presence in the community that you want to study or work with, and to be involved in community meetings, have an active presence at community events, reach out to the community organizations that are champions for subgroups, and develop relationships with them. Basically, grow your network and be genuine in your relationships. Establish trust. And really, when working with older adults, think out of the box. We were doing a survey of East Harlem older adults to learn about their experiences during the COVID pandemic. We contracted several older adults who were trusted in the community to help us get the surveys done. These folks were respected and well-known, and they vouched for the research team, which opened many doors. We had to quickly pivot when the older adults were struggling with technology in completing the REDCap survey. Our answer was to create an intergenerational model pairing MPH and medical students with older adults to help complete the surveys, either in person or via phone. Often, the word research frightens folks, and so it behooves the recruiter to be patient and describe in detail what participating in the trial means. Often, the literature we use to promote a trial, and of course, the consents participants need to complete, use complicated language that lawyers like, but leaves potential participants questioning what it is they are signing on for. At times, people volunteer for trials because of the incentive they will receive, and they may not be the right candidate for your study. So training your team and helping to identify scenarios they may encounter when recruiting will result in identifying more appropriate candidates. As an investigator, I approach the work with curiosity and a desire to continue to learn. As an experienced researcher, you have expertise in your field. And community members are experts too, in their environments, in their communities, and they know what will work and what is needed. Humility and mutual respect will go a long way toward making your project successful. There is this misconception that enrolling in a clinical trial equals being used as a guinea pig. Addressing this can be time-consuming, but well worth the investment. The more we can provide information and allow for exploration and clarification, the more we can contribute to demystifying research and encouraging participation. Over the years, I've seen how much the East Harlem community has grown with regards to understanding and participating in research. They are clear about what's important to them, and they hold us accountable. They require that we share what we've learned and at times ask us to use our findings to improve the health of their community. One last tip. If you have a good research assistant that is already embedded in the community, do whatever you can to keep them on board even beyond your grant period. Thank you.